Good afternoon, everyone, and welcome to this, which is our third presentation by my centre for 2021. My name is Bernadette Watson. I'm Director of the International Research Centre for the Advancement of Health Communication. We've been operating since 2017, and I hope you will take some time to go to our website to see the kind of work we undertake. In brief, and I will be brief because I know you all come to hear Tarli, not to hear me, the Centre is committed to delivering global healthcare communication research in collaboration with interdisciplinary researchers, health practitioners in the field, and to engage the Hong Kong community. This focus is reflected in the key areas of work pursued by my centre, such as work on lung cancer stigma, end-of-life issues, and working with emergency departments to enhance interprofessional communication. The contribution of the centre is aiming to impact the development of healthcare policy, healthcare education, best practice guidelines for healthcare professionals, patient safety and quality care, as well as the well-being of health professionals and the deepening of interdisciplinary collaborations. This particular presentation, which is co-hosted with the new Mental Health Research Centre, has come about because of my interest in increasing well-being and resilience in the health professional community, who we know work in a high-stress environment. Since 2019, I've had discussions with colleagues in a Hong Kong hospital who recognise that more can be done to support health professionals when they work under high stress by giving them strategies to manage their extremely busy work life more effectively. Importantly, and coming from a positive psychology perspective, it's about assisting professionals to enhance their strengths and to use those strengths to bring about ways of managing their challenges so they're not worn down by the challenges, but learn to develop new ways of approaching those challenges and so build up resistance. I am hoping to build on Dr. Young's talk by developing modules that will be available for all health professionals. But let me now introduce Dr. Tarli Young, who is a Postdoctoral Research Fellow in the School of Psychology at the University of Queensland, where she also lectures in positive psychology. Her work focuses on well-being interventions and research in mindfulness, well-being science, meaning in work, and social identity. Each of these fit within her overall aim of improving the well-being of adults, particularly within the workplace. She specialises in research on improving well-being in high-meaning, high-stress careers. And I've known Dr. Tarli Young for quite a number of years, and I'm very pleased to have this opportunity to introduce Tarli. So I'll now stop sharing my screen and I'll say over to you, and thank you.
Thanks, Bernadette. I'll just share my screen. Hopefully you can see that okay.
Yep.
Perfect. So I'm really thrilled to be here today to talk with you all. So thank you to Professor Watson and her centre for having me here. As Bernadette said, we've worked together for, I think, 6 or 7 years now, so it's great to be here. Bernadette just did a great introduction of me, so I won't talk too much about myself. But yes, as she said, I lecture in positive psychology. I'm interested in well-being, and I'm particularly interested in strategies that can help improve well-being in adults. I've done a lot of research around aid workers, humanitarian workers, and healthcare workers. So people who are working in really high stress kind of environments. So in order to think about well-being among clinicians, and when I say clinicians, I'm referring to doctors, nurses, allied health professionals, just health professionals in general. So in order to think about well-being, we first need to think about stressors, because stressors affect us and they affect our levels of happiness and well-being. So let's think about some of the stresses that we face, and particularly some recent research with Hong Kong clinicians in Hong Kong has noted some key stresses. These are, I would say, are quite universal. We see them in Australia and in the UK as well. So insufficient resources and space, staff shortages, which can lead to long work hours, low clinician to patient ratios, short consultations, which in general clinicians feel in this research, they suggested it reduced patient care. And all in all, this leads to quite high pressure kind of scenarios, long work hours, a lot of pressure put on the clinicians. At the same time, the clinicians who were interviewed for this research noted a lack of organizational support, inadequate systems and procedures, bureaucracy, poor technological support, and also a lot of interpersonal tensions. And Professor Watson's work really focuses in on those communication issues and how they can occur with colleagues, with patients, with the families of patients, and also issues of hierarchy. So there tends to be quite strict hierarchy within medical settings. So all of these are some of the common stresses faced by clinicians, and these are particular to Hong Kong. This particular research was. And this has gotten worse recently, right, because we've been going through a pandemic. So when we look at COVID stresses in Hong Kong, this is residents of Hong Kong in general, we can see there's been an increased amount of stress, increased anxiety, and there's been a doubling of depression symptoms. So this has been dubbed a mental health emergency, even though the outbreaks have been well managed and the cases haven't been as high as other countries. So you can see it's causing a lot of difficulties. And there's additional difficulties for health professionals in Hong Kong, including fear of infection for themselves and for their families, and also just general low well-being. So one study noted that 50% of professionals, of clinicians during the pandemic were experiencing mild to moderate depression. So it's a problem, right? So what I like to think about and what I like to research and recommend are well-being strategies that can help overcome some of these things. So what I'm hoping to give you today is a really quick tour of the many tools, some of the tools that are available. I can't cover all of them. And each tool I'm only going to spend a few minutes on, because normally I would spend a whole hour just on one tool, but what I'm trying to do is give you an introduction to lots of different strategies in the hope that you might see something that's useful for you. So I'd encourage you to choose one and seek out more information on that one. And I'm going to provide some more resources at the end that you can follow up. As Bernadette said, her centre is also developing some modules around enhancing well-being and strengthening resistance in high stress environments. So that's another way of following up. So what I'm going to talk about, I've got a few different areas. I want to talk about the context, the workplace that we're working in, which has a big impact on well-being. And then I'll talk more about the individual at different levels. So managing difficult thoughts, working with difficult emotions, and then the types of actions that we can take, ideally value-based actions. And a lot of these tools I'll talk about at the individual level are preventative tools. So they're things that we can do by ourselves. They come a lot from positive psychology. All right, so let's talk first about wellbeing strategies, contextual wellbeing strategies, because it's really important to talk about the context because it has such a big impact on our wellbeing. It's not realistic to expect people to thrive and to have high levels of well-being if they're in an incredibly stressful environment, which causes a lot of burnout. So what I'd like to talk about the context, and I'd also like to briefly talk about the work outcomes of low levels of well-being. So it's not just for clinicians that it's important, it also impacts where clinicians have low levels of well-being. I would highlight that it impacts their organisation and also the patient care. And so in one study, doctors in hospitals who had depression made 6 times more medication errors than those who were not depressed. We also see more broadly within the workplace, those who have low levels of well-being tend to take more sick leave, they have higher turnover, which costs the organisation in terms of training and replacement, and it leads to lower patient care. So the reason I make this point is that clinicians are often not good at prioritising themselves. And so if you need to think about it in this context, you'll prioritise it in order to help your work, your organisation and your patients. So what can we do at the workplace level? Some things are out of our control, right? We don't all have the power to fix those stresses that I was talking about before. Where you do have the power to fix them, staffing levels, pay, you know, those types of stresses, I'd encourage you to do so. But for the rest of us, what we can do is advocate for changes. This might be completing staff surveys, talking to management, giving input when it's sought from you, if it's sought from you, to counteract some of those stresses that we saw. So some of those, the staffing levels, increasing staffing levels, reducing hours, advocating for better resources where possible. You know, and it's not always possible to do these things, but if the opportunity presents it, I would encourage it. We can also make small changes within our day-to-day work. So it could be, you know, inputting on a better process for staff well-being, something that will help staff be happier in the workplace, creating a slightly different roster, doing things a slightly different way in order to improve the context and the work setting that people are working in. We can more generally support staff well-being by talking about well-being, by making it part of our everyday language, by, you know, signaling that we're prioritizing staff well-being. We can share our own challenges when it comes to well-being to normalize talking about staff well-being. We can encourage the people to use counseling, to use trainings like Professor Watson is talking about. And in general, talking about well-being and prioritizing well-being really can build this culture which encourages us to prioritize well-being, to support others who are seeking help. So speaking about the importance of well-being in the workplace can slowly shift the culture, and it can help others who have low well-being. And where you're able to support others that have low well-being, it will also have benefits for yourself, because that helping action tends to help the giver as well. So what we're looking for here is a shift in culture where it's okay to talk about staff well-being and people note what can be done for staff well-being. So those are a few thoughts about the context, and I just wanted to note that the context is important. Mainly, I work at the individual level. So when we think about, the next thing I'd like to speak about is thoughts. And sorry, I'm going to be moving through quite rapidly because I'm trying to cover so much. But when we think about thoughts, humans are unusual among animals in how busy our minds are. So we have the ability to plan, to remember, to worry, to imagine. And this is a really fantastic skill. It's something that's allowed humans to dominate so much. But it can also be really problematic for our well-being if we get caught up in unhelpful thoughts. And so what I'm going to talk about today are some skills that can be useful in working with difficult thoughts. I just noticed there's a question that's come through the chat, sorry, and I'll just take questions at the end if that's okay. All right, so let's think about some skills that could be useful with managing thoughts. One strategy is called mindfulness, which a lot of you will have heard of. We have diffusion and also gratitude. All right, so starting with mindfulness. So you may have heard a lot about mindfulness because there's been a huge growth in mindfulness research and mindfulness practice. And that's because it's really effective and there's a huge amount of research to back that up. So let's start with a question, what is mindfulness? Mindfulness is when we pay attention to our current experience. So that could be internal experiences, our emotions, our thoughts, our physical sensations. It could be external experiences, sights, sounds, smells, that type of thing. So it's a state where we're paying attention to our current experiences. But importantly, we do that with an attitude of acceptance, kindness, and openness. Because without that kind attitude, mindfulness could become a negative kind of experience. If we're very hard on ourselves while we're doing it, it will be a negative experience. So these two things, the attention that we pay and the attitude that we bring to it, are sometimes called the two wings of mindfulness. They're both equally important for mindfulness to work. So that's a bit about what mindfulness is. It's also good to note what mindfulness is not, because there are misconceptions around it. It's not a relaxation technique. relaxation is sometimes an outcome of mindfulness, but it's not the main aim. It's not a religion. It's not only about meditation. It can be done less formally as we go about our day-to-day life. And also, it's not a way to stop or change thoughts. That's a common misconception, meditation and mindfulness. We're not aiming to stop thoughts, and that very rarely happens. Thoughts, often automatically pop up. So the aim is to just become more aware of thoughts and feelings and to watch them. So why do mindfulness? There's a lot of beneficial outcomes that research evidences in terms of well-being outcomes, mental health outcomes, physiological outcomes, and neurological outcomes as well. So I'll just put those up there so you can see that there's lots of great outcomes for it. I guess what we're talking about today is resilience and well-being, and mindfulness definitely does promote both of those. I've done a research program with Hong Kong residents in Hong Kong. This is a community sample in Hong Kong and also in the UK. And the participants, you can see the Hong Kong participants who undertook an 8-week mindfulness program are that black dash that's going up there. And what you can see here is that the Hong Kong participants who undertook the mindfulness program had a significant increase in gratitude, a significant decrease in negative affect, which is essentially negative emotions, and significant increase in meaning in life and in self-compassion and in overall well-being as well. So this is essentially to say that it is an effective approach, and luckily there's hours of free online resources available to teach mindfulness as well. So you can learn mindfulness meditation, or you can, it doesn't need to be a huge meditation though, we can just practice pausing and paying attention to what's going on with an open, accepting attitude. So you can even do this now as you're listening. So all you need to do for a mindfulness pause, and this can be as you're walking around as well, but you just need to sit in a quiet, comfortable position, in a quiet place, in a comfortable position, and focus on a sensation to keep you present. So this is called anchoring to the present moment. So often people use their breath, but if that's uncomfortable for you, you can use sights and sounds or the feel as you sit on your chair. And you might notice thoughts that are coming and going, thoughts about this talk or what you have to do later. That's fine. It's fine to get distracted and have thoughts. The trick with mindfulness is to notice it and return to the present practice. And while you're doing this, you keep an attitude that's accepting, kind, open, and curious. So if you can just notice for yourself now how you're feeling, how your breath is going in and out, any sounds around you. And so that's a quick mindfulness pause. If you've done that with me, you've just practiced mindfulness. So mindfulness does not need to be a lengthy meditation. The lengthy meditations do help, but mindfulness can be done informally in that way as you walk between consults or as you're listening to someone, as you're eating, you can practice mindful speaking, mindful listening. So that's one way of learning mindfulness. And it's a really powerful technique. What you may have noticed then as we were doing that is that you may or may not have noticed that your mind is very busy. And that's okay. As I said, we don't need to stop thoughts. People tend to have quite a lot of thoughts going on. We're not trying to stop them. We're trying to let them pass. Just look at them and let them pass like clouds in the sky. And this is something that's important. So I want to talk about it a little bit more now, because the act of letting go of clouds, letting go of these clouds, these thoughts, and letting them pass by is called diffusion. And when we get really caught up in them, that's called fusion. So this is what I want to talk about next. So to do this, though, we first have to think a little bit about our thoughts, which is not something that we do that often, right? So what are thoughts? Thoughts are mainly made up of words and images. And they're often automatic. They just pop up automatically. We're not necessarily controlling them. They tend to be conditioned by our life experiences, by our previous life experiences. So I can have a thought like, I can't do this. I can't do this talk, whatever it is. I don't, I'm going to fail at this or whatever it is. And, it's not necessarily a very helpful thought, but that's not really the problem. So the trouble is not so much what we think. The problems are not caused by the content of our thoughts, but our relationship to our thoughts. And so there's different ways of relating to thoughts, and fusion is one of them. So fusion is a relationship with our thoughts where we're really caught up in the content of thinking. We're really fused with our thoughts. It's known as fusion because the thought and the thinker are fused together. In this kind of fused state, we think we are our thoughts. We can't see them as something separate, something transient that comes and goes, temporary words and images, which is what they really are. We get really caught up in them. And when we get really caught up in them, they tend to affect us a lot. We see them as literally true, and they influence our behavior, which is not a problem if it's a helpful thought, but if it's an unhelpful thought, like that one up there, I can't do this. If I have the thought, I can't do this, that's not a problem. It's only if I fuse with that unhelpful thought that it's going to be problematic. Because if I fuse with the thought, I can't do this, then it's going to affect my behavior. It might make me give up, for instance. But it's important to remember that words are nothing more, that thoughts are nothing more than words and symbols. So they don't control us. And it's only when we fuse with them that we become really affected by them. So if we fuse with unhelpful thoughts, it can really take us away from things that we'd like to do. And it can really cause a lot of problems for us, negative self-talk that we believe in. So what's another option? If diffusion is getting really caught up in our thoughts, the opposite of that is defusion. So defusion is when we separate from our thoughts and are able to see them as something that's part of us, but transient, something that's coming and going. And just thought, they're just words and images. We're not getting caught up in them. We're not buying into them. And this allows us to look at our thoughts rather than from our thoughts. And so from this watching position, you can decide whether you want to fuse with the thoughts and which thoughts you'd like to just observe. We notice the thoughts rather than becoming entangled in them. So you can see here this idea of watching thoughts go by. It's not about controlling or stopping thoughts. It's just about creating some space between ourselves and our thoughts. And this space is really, really powerful. I can't overstate how powerful that space is, because when we're able to create that space, we're able to choose which thoughts are helpful for us. And I'll just show you a quick sort of diagram so you can see what this looks like. So we create the space between ourselves and our thoughts, and that allows us to watch the thoughts. And then we decide, is this thought helpful or unhelpful? And the one way of answering that question is, does this thought help me live the life I want in line with my values? We can ask that question. Often we can just ask, we tend to know if thoughts are helpful or unhelpful. So if it's helpful, like I need to get to my meeting on time, I might fuse with that. Yep, okay, I'm going to let that affect my behavior and I'm going to get there on time. If it's unhelpful, like you're going to fail, you're worthless, you can't do this, these kind of unhelpful thoughts that are quite common for people, I can decide to defuse from that and let it go and let it pass. So defusion like this gives us a lot of power because it means that our thoughts don't boss us around anymore. We spend a lot of time getting bossed around by these words and images that are really just transient kind of things. So defusion is the key mechanism of mindfulness, of meditation, of cognitive behavior therapy, of acceptance commitment therapy. It's a very powerful kind of tool. It's interesting though, because I can tell you about this tool, but what you really need to do is do practice in order to create that space between yourself and your thoughts. So how to do this? Well, there's existing structured ways like meditations, mindfulness, acceptance commitment therapy focuses a lot on diffusion. And there's a lot of free resources available on all of these. But you can also try it informally. And I can give you an example of that now. If we take a common unhelpful thought, like I'm not good enough, if I decide that, this is not a helpful thought, and each of us has common unhelpful thoughts, I can use some phrases around this that will create a little bit of distance. So I'll use this example for you. I notice that I'm having the thought that I'm not good enough. So when this thought pops up, instead of just thinking I'm not good enough, and really buying into it, we put some space between ourselves and the thought, and we say, my mind is saying I'm not good enough. This is just a thought. Or go one step further. Thank you, mind, for giving me this thought that I'm not good enough. So if you try out these kind of phrases when unhelpful thoughts come up, you might notice a lot of people say it gives them a little bit of distance between themselves and that unhelpful thought, so that you're observing the thought and you can't be caught up in it. These sentences are all ways of framing thoughts that allow you to put some distance between you, the thinker, and the thought. And this is something you can try. Other techniques, I've seen people sing the thought, or they do the thought in a funny voice. Anything to sort of take the power out of it a bit, and so that we can really see that it's just words and images. So that is sort of a quick run through on diffusion. I wanted to do a little touch more on gratitude. So gratitude is something that's been studied a lot in positive psychology because it's quite a simple but powerful technique. So essentially, gratitude is a sense of thankfulness and joy for an outcome or for another being, another person. Some people don't like the term gratitude, and you can sub in the term appreciation instead if you like. A lot of great outcomes from gratitude, and a lot of the time it's one of a key simple activity that's used to boost positive emotions and happiness. So if you're interested in trying this, there's simple activities that you can do. You can write a gratitude letter to someone you're grateful for. So a past teacher, a mentor, a friend, a family member, a parent. You don't have to deliver it, but you can if you like. That can sometimes be helpful. But really, a lot of the power comes from actively just writing down your gratitudes. You can also write down 3 good things that happen at the end of each day. So take a week and write down, at the end of the day, write down 3 good things that happened. And this can, or you can share it with someone else. All you have to do is sort of, write down, what am I appreciating today? And what the studies show with this one, which is quite interesting, is just a small amount, like 1 week intervention, can have quite long-term effects when it comes to positive emotions. So over here, we can see a graph. The people who did the experimental group, who did the 3 good things, here in black. And what we can see is they did a 1 week intervention, and they saw the benefits in terms of happiness 6 months later. They were still increasing in terms of happiness 6 months later when compared to an active control. So I think this is the reason that these gratitude interventions work, is because they shift our perspective. So we start to notice the good things that happen in our everyday life. And this really helps to counteract the negativity bias that humans have. The negativity bias is an evolutionary adaptation where we tend to focus on the negative things that happen during the day. And this was adaptive from an evolutionary perspective because it was important for survival. Negative things that happen require a lot of attention if you're fighting for survival. Is your food running low? Are you going to be attacked by a tiger? These types of things require a lot of attention if you're fighting for survival. But most modern humans are not fighting for survival anymore, but we still have this negativity bias. We pay more attention to the negative things that happen in our life. So by actively practicing gratitude, it helps us notice the good things that happen during our life, and it makes us more appreciative of it, and it counteracts that negativity bias, and then it leads to increases in positive emotions. All right, so that was a bit about working with difficult thoughts, and there's other strategies out there. Those are some of the ones that I think are quite powerful. So I want to move on to working with difficult emotions. That can be quite tricky, right? So a couple of things I want to talk about are strategies, self-compassion and acceptance. So let's start with self-compassion. To do that, we need to think a little bit about self-talk. because self-compassion is largely about how we talk to ourselves when things are difficult, when something's gone wrong, or when we have difficult emotions. So a quick question I want you to ask yourself is, how do you talk to yourself when you make a mistake, when you say something silly, when you fail at something, when you feel sad? And then the same question again, but this time, how do you talk to a good friend when they make a mistake, say something silly, fail, or feel sad? So when we ask this question to people, they tend to say that there's a big difference between how they talk to themselves and how they talk to their friends. So if a good friend is going through a difficult time, we tend to be quite kind, supportive. But when an individual is going through a bad time, a lot of people talk to themselves in quite a harsh kind of way. They're quite down on themselves. They talk to themselves quite poorly in a way that they would never talk to a friend. Sometimes people do it because they think that by being hard on themselves, that's a way of succeeding. But that's unfortunately counter to the research, which shows that people who have a kinder self-talk tend to be able to succeed more because they're more willing to take risks, to innovate, and they have higher well-being, which is in general associated with higher work success as well. So the antidote to this negative self-talk, one antidote is self-compassion. So self-compassion involves being aware of the times when you're struggling with feelings of whatever, difficult feelings, inadequacy, despair, other forms of distress, and responding to that with kindness and understanding. So there's three distinct components to this. One is mindfulness, which we've already covered. So bringing that accepting attention to challenging thoughts and emotions, because we need to be aware of those difficult emotions before we're able to respond in a kind way to them. How do you do this? You notice those thoughts and emotions without judgment. You let them be there and try to describe them objectively. Oh, I can feel a tightening in my chest that might be sadness, or in my stomach, or I can feel some heat in my head that might be frustration. Whatever it is, trying to describe them more objectively as sort of physical kind of sensations can be quite helpful. The second component is common humanity, and this is the understanding that you're not alone in your struggles, that discomfort, that difficult emotions and difficult thoughts are part of the shared human condition. A lot of the time, everyone goes through struggles, right? But people tend to wear a mask, which makes it difficult for others to see that they're going through struggles, except for those who are really close to them and who know them well. So we see all of these other people around us that seem to be doing fine and seem to be not struggling at all. But so we're not aware that most people are experiencing discomfort and suffering of some sort. So common humanity is about being aware that everyone is going through struggles. So reminding ourselves that others also make mistakes and feel bad. And that's just part of the challenge of being human, and it's okay. And then the third component, very important, is self-kindness. That's self-talk, being gentle and understanding with yourself when you're experiencing distress, trying to practice having less of that negative self-talk and having a kinder self-talk. And to do this, we just think about how you would treat a good friend and talk to yourself in the same way. And this can be awkward to start with, but a really good practice to build up, talking to oneself in a really kind of way. There are distinct activities you can do for this. I've listed some at the end. So self-compassion pause, write a self-compassionate letter to yourself. There's actual meditations around it that you can also use. And a lot of people, if you do have a negative self-talk, then this is the one that I would recommend for you because it can be very powerful. It leads to increases in happiness, optimism, higher levels of self-worth. It's also been shown to decrease anxiety, depression, feelings of inferiority, self-criticism, rumination, lots of really great outcomes when it comes to this one. All right, so moving on from that, the next thing I wanted to talk about is acceptance, and that's one way of working with difficult emotions. So to talk about acceptance, I want to talk about the opposite, which is experiential avoidance. So experiential avoidance, in essence, is not wanting to feel how you're currently feeling, not wanting to have the thoughts that you're currently having, not wanting to be in the context where you currently are, just trying to avoid your current experience. And it's really, really common. And it's particularly common when we move towards something that's important to us. So we move towards something we value, an important goal, and then we're going to nearly always experience difficult thoughts and difficult feelings. So this is like the stress that comes from studying towards a degree that's important to us, towards a qualification. Could be the difficulties of parenting children. At a smaller level, that anxiety that a lot of us feel when we're meeting up with people socially. These are all things that are important to us, but they all have negative emotions and difficult emotions and thoughts that come with them. Could be anxiety, sadness, frustration, stress. So that's fine. It's fine to have all those feelings. But what happens is we tend to have a natural tendency to not want these feelings. They're unpleasant, right? And so our natural reaction is to want to push them away, to try to move away from them. And this is what causes problems. The feelings themselves don't cause the problems. Wanting to not have them causes problems. So in that wanting to not have them, we all have different struggle strategies that we might use. Here are some. So think about, as you read these, think about what you use to avoid your current unpleasant experiences. These are things that tend to distract us or numb the unpleasant feelings. So I tend to try to keep busy. I might eat. I try meditation. There's lots of ones, watch TV. There's lots of ones on here that I use. These are some of the common ones. You might have other ones. So some of these strategies can be helpful or at least neutral in the short term, but some have harmful effects in the long term. And in general, struggling against our experience can cause overall problems. So there's three big problems that come from this struggle. One, okay, it takes us away from the things that we value. So as I said before, most of the things that we value, most of our important goals come with difficult emotions. If we always try to avoid those difficult emotions, we won't be able to take on anything that's challenging. So if I really don't want the anxiety that comes with interacting with people socially, with going to that party, I might avoid going to any social interaction. You know, if you want to run a marathon, you have to go through some pain to do it. If you want to go for a promotion at work, you will have fears of failure. You will have anxiety about doing that. And that's totally normal. If you really want to avoid those feelings, it could lead you to not going for that promotion, not doing that thing that's important to you. And so therefore, by really trying to avoid those difficult feelings and thoughts, this can lead to a very narrow and unfulfilling kind of life. Big problem number two is it tends to amplify our pain. So this is essentially known as when we push away unpleasant emotions, they tend to grow. It's known as the rebound effect. So what tends to happen is we start with some small unpleasant emotion, like guilt, and we pile other things on top of that. I might feel a bit guilty, and then I feel sad that I feel guilty. I feel anxious about the sadness. I get frustrated at myself for being anxious. I feel irritated in general. And I also might start to pile physical tension on top of that. So I think most of us know that feeling of feeling very physically tense in the throat, in the chest, wherever it is in the stomach. And essentially what we've done is we've taken an initial unpleasant emotion and because we didn't want it, we've amplified it and put all this tension around it. So that's problematic. It grows. Number three, when we try to avoid unpleasant emotions, we also become unskilled at noticing pleasant emotions as well. So when we numb out from unpleasant emotions, we also numb out from positive emotions as well. So there's lots of big problems with experiential avoidance and trying to this idea of wanting to not feel what we're currently feeling, to the point where some researchers and psychologists have suggested that most psychological suffering is caused by experiential avoidance. This not wanting to feel what I'm currently feeling, not wanting to think what I'm currently thinking, not wanting to be where I currently am. So this is a root cause of a lot of psychological suffering. It's the root cause of addiction, of a lot of mental health difficulties, and it also lowers our well-being and our resilience, which is why we're talking about it today. So experiential avoidance, unhelpful, causes a lot of problems. What's an alternative to this? One is acceptance. And some people don't like the word acceptance, so you can replace it with the word willingness if you like, but it's essentially the ability to drop this struggle and let the feelings and thoughts just be there. Making room for these unwanted feelings, sensations, and thoughts instead of trying to control them. So this may seem like an unusual approach. It doesn't come naturally to a lot of people, but it is backed up by a lot of research. Acceptance is choosing to feel whatever arises, even feelings we don't like. Stopping the struggle with the difficult emotion and setting it free, watching it. So it might get bigger or smaller, it might go away, it might stay where it is. Often when we accept an emotion, we notice it's actually not that bad. You know, it's not as bad as we had thought when we were trying to avoid it. And often it goes away quicker as well. That's not necessarily the aim. The aim is to just watch it. So what are the benefits? Well, they counteract the problems we saw before. By letting the emotion sit there and be there, that initial unpleasant emotion, we don't pile other emotions on top of it and other tension. So we don't amplify the emotion. We might have that initial guilt, but I'm not putting sadness and irritation and tension on top of it. It also helps us move towards, when we're not struggling with our current experience, we can focus our attention and our behavior and our energy towards the things that we value. We can train for that marathon, even though we're feeling anxious. I can go for that promotion, even though I'm feeling scared of failure. And so it frees us up when we're not constantly trying to fight with our emotions and thoughts. We can do what's important to us. And we also become better at feeling all emotions, including the positive ones as well. So the trick here is that this doesn't always necessarily feel pleasant, because we have to come to terms with these difficult emotions instead of trying to distract ourselves all the time or suppress them. But it will help us live a more fulfilling life, which in the long term increases our happiness and our well-being. So how do we do this? We can practice watching our emotions with kindness, bringing in that kind attitude again, informally. During the day, right now, you can scan through your body to look at the emotions that you're experiencing, how you're experiencing them. I tend to experience difficult emotions in my throat, other people in their stomach, wherever it is, and sort of relaxing around it, watching them with kindness and just letting them be there, welcoming them in. It sounds counterintuitive, but it really is. It really works, and it is quite powerful. It's difficult to get in the habit of it though, so it's something that I'd encourage actively practicing. So you're deliberately trying to scan through your body and drop the tension around difficult experiences. There's formal practices as well, body scans, meditations, acceptance commitment therapy focuses a lot on acceptance as well. All right, so that leaves us to actions, the actions that we can take. So I think it's something that's really important is to be able to take valued actions, so actions that are in line with your own values. But the first step for that, of course, is understanding what your values are. So we spend a lot of time just doing things, right? You know, our boss asks us to do things, our kids need us to do things, whatever it is, we're doing things all the time. And sometimes we're just on autopilot and we haven't really thought through why we're doing things, and we haven't deliberately chosen our actions for any particular reason other than they're expected of us. So I think it's really important to take time to think about your values, what's important to you. And there's lots of online options and surveys that you can do to help you do this. Bernadette talked about strengths, character strengths. There's online character strengths tests that you can take. And there's ways of identifying your own values. One is to, if you're doing work values, imagine yourself at the end of your career looking backwards. And in an ideal kind of scenario, what has your career looked like? Who have you been? If you had the ideal career or the ideal life, what type of person would you have been? What were you passionate about? How did you help other people? And from that, you'll start to get a sense of what's really important to you. Often the things that we're chasing, whether that's money, material goods, status, are not important in the long scheme of things. So thinking in that long kind of scheme can help us identify what's really important to us. And then we can write it down. And once we know what's important to us, it's important to try to prioritize our time and our actions around this. Then you can try to, do so within your work if that's possible. If it's not, look for small ways of doing it outside of work. But often there's small ways of doing it inside of work as well. If you value creativity, is there an online art course that you can take? Or can you be creative about a process in your workplace? If you value helping others, which a lot of clinicians do, notice when you're helping patients, pay attention to spot those meaningful moments in your work time where you are helping others. So taking valued actions is partly about deliberately planning actions that you can take, but it's partly about spotting when you are doing things that are valuable to you to enhance that sense of, oh yes, I am doing, this is in line with my values. And that's really important for our well-being as well. So that's a brief sort of overview of valued actions. I just wanted to talk a little bit about two specific areas of action. One is social connection and one is wellbeing hygiene. So social connection, to start this, I just wanted to, pose the question, what is important for physical health? So this is something that you'll all know a lot about. My colleagues here at UQ surveyed hundreds of people, and they asked them to rank factors in order of what they thought were the most important ingredients for good health. This is what they came up with. They thought never smoking was very important, doing exercise, not being overweight, great. Social integration and social support, they ranked as last out of the factors they were given. But results of a meta-analysis and a lot of different research, but a specific meta-analysis with data from over 300,000 people showed a really different results. When it came to physical health, the factors that were most important were social support, social integration. So social connection is extremely important for both physical and mental health. It's really important for our well-being and it's really important for our physical health. And I think this is it's a relatively new idea, but it's gaining a lot of traction, and it's probably something that you're all aware of, and it's something worth keeping in mind. It's particularly worth keeping in mind right now, because with lockdowns and things like that, it's very easy to allow the seclusion that was required in lockdown to become an ongoing, deliberate kind of isolation. So as we, hopefully re-enter society, it can be helpful to think about the groups that we do want to connect with, because social groups provide really helpful psychological resources. So ideally, we want to connect. A lot of the research of my research group here talks about, what groups do we want to connect with? The groups that are most helpful for well-being tend to provide support. They tend to align with our values and our goals. They provide a positive experience. We enjoy being part of them. And ideally, they're enduring. They'll be with us for a long amount of time. So have a think about, exiting lockdown or, starting life again. It's a chance to think about who you want to connect with. So with our participants here, we tend to make social plans, because our social life is something that often just sort of happens to us. We're not actively planning it out a lot of the time, but it can be really helpful to actively think about which existing groups that you already have would you like to reconnect with? Are there any new groups that you'd like to join? Are there values and goals that you're currently not living out in groups and you'd like to follow them up? And once you've chosen that, what's the first small step that you can take? Something really concrete, like sending an email or calling a friend, whatever it is, and then setting a time and date for that. I will call the croquet club tomorrow. I'm not joining croquet, but I will join, I will message the sailing club on Saturday. I will join a book club by next week. So by identifying this concrete small step, that can be really helpful in sending us forward in this social plan. And one thing to note there is that discomfort is bound to come up. I've talked a bit about social anxiety. Most people feel social anxiety of some level. So when you're joining a new group, it's okay to feel uncomfortable. We've talked about different ways of dealing with that discomfort. it's worth it for the gain that you'll get. All right, the final thing I wanted to talk about just very briefly is essentially this idea of wellbeing hygiene. So the idea behind this and the research behind this suggests that all of the things that are good for your physical health are also really good for your well-being. So clinicians know a lot about the importance of all of these for your physical health. I'm not sure about clinicians in Hong Kong, but here in Australia, clinicians tend to be better at helping patients with these factors than they are at prioritizing these in themselves. So it's also worth, I think, knowing that in addition to these being important for our long-term physical health, they're also really important for our happiness and our well-being. And I tend to find that that can be really motivating for people because you get quite a quick feedback loop, right? So if someone improves their diet, gets good sleep, becomes physically active, gets outside into nature, it can increase their happiness in hours, days, weeks. You're getting quite a quick feedback. So it can be very motivating to know that these things also boost your happiness. And there's a lot of evidence to suggest this as well. All right, so though that was a very quick tour, and I'm sorry for the very speedy way I went through that, but I really wanted to give you an idea of some of the wellbeing strategies that are out there. And Professor Watson is developing those modules on those topics to enhance well-being and strengthening resistance. So let her know if you're interested in those. All of these topics as well have a lot of free resources on the internet. One of the benefits of these is they are preventative and they can be self-led. So there's lots of resources available. I've shared some in the slides. And these slides are going to be sent out, so you don't need to read through these now, but I've put links. And I've tried to include a range of activities and also research so that you can look into some of these ideas yourself if you're interested. So I'd like to finish, I guess, with this idea about putting on your own oxygen mask before helping those around you. So what we see with people who work in careers where they help others is that often they do not effectively look after their own well-being. Because there's this idea that they should be helping their patients or they should be helping the recipients. But you will be a better clinician and a happier person if you can take steps towards improving your own well-being. So one of the best things you can do is prioritize your own well-being. To do that, you can pick one of the topics we've discussed today and commit to trying out an activity, learning more about it. This will be good for you, for your families, and also for the people that you help, for your patients. Because only when we're able to first help ourselves can we help those around us. So it's something I'd really like you to prioritize in your own life if you're interested. And with that, I will finish up. And thank you very much for listening. Hopefully we have some time for some questions now.